Okay, so I'm going to be talking about assessing the peroneal musculature and structures for tears. Prior to doing so, I'm going to make sure that I have sterile equipment and I have a good light source. I have my sharps container and an assistant that's going to be helping me by making sure that my sterile field does not get contaminated. I'm going to provide information to the clients prior to examining and always ask for consent. I'm going to give a step-by-step of what I'm doing during the exam. So before we start, I'm going to review the structures and muscular tissues and the muscles. So I'm going to start by, that's labeled. So the clitoris, the ischiocavernosus, the bulbocavernosus, urethra, the vagina. Transverse perineal muscles go across the anus, the external anal sphincter, the levator ani, right there, the coccyx, and the gluteus maximus. When I'm getting a visual of those structures, I'm going to make sure that I could actually see what I'm doing. So this is going to be an example of the vaginal opening, anus, clitoris. I'm going to go ahead and wipe away any blood or clots that may be getting in the way. And I could even create a little tampon out of gauze when I'm suturing. That's not what I'm going to do right now because I'm just getting a visual. So I'm going to start off looking up by the clitoral hood all the way down to the anus. It's important to remember that most tears are going to be, most tears aren't going to end up in a third-degree tear or muscular damage, but that can happen. If I have a tear that is more than a second-degree tear, or if it's affecting the cervix, or if I'm getting blood in a catheter, or blood while I perform a catheter, blood in the urine after performing a catheter, I will transfer for those types of tears because it's going to need a lot more than what I'm going to be able to provide. So I'm going to look at any signs of tears by spreading open with my gauze, or with my sterile gloves, the lips, and I'm going to spread open the lips and look for any tissue that might be red, pink, meaty. Any lacerations, I'm going to look at the edges of the lacerations, if they're rigid or straight. I'm going to look if the lacerations fit nicely together. I'm going to look at if the lacerations are on symmetrical. If they are symmetrical, then I would recommend getting sutures because we don't want those to heal and close. And I'm going to check the depth of the tear by getting a good not only visual but feeling. So I'm going to go ahead and assess, and after I assess, I'm going to make sure that I talk to the client about their options. They don't have to suture, but it is recommended in some cases, but always up to them. I then am going to show you how I would repair. So I already filmed my video earlier, so and to avoid making two videos or posting two videos, I'm just going to record myself here. Okay, so I think that is wrapping up my video. If my client decides to suture, then I will provide instructions how to care for those sutures, as far as going to the bathroom, using a peri bottle, any sensations, what to look for that's normal, what to look for that's abnormal. I would explain that the sutures dissolve and advise them to call me if they have any questions. If the client declines suturing, I will explain the importance of being very careful, resting. Either way, they should be resting, but especially if they're not going to suture, resting, avoiding flights of stairs, keeping their legs close together. Those are all the things that I would recommend. Staying hydrated, eating nutritious food, all those things that you should be doing postpartum anyways. I think that is it.